Expanded Program on Immunization, or the EPI. So this one is established in 1976 to ensure infants or children, and of course the mothers, have access to routinely recommended infant or childhood vaccines. So as you will notice, in each barangay, most of the barangay health workers were doing their house to house for them to encourage the mother with regards to this vaccines. So if you will be availing these kinds of vaccines, you can avail this one for free. Unlike if you will be visiting your private pediatrician, you will be spending too much with regards to this vaccines. So as nurses, we need to suggest, or we need to recommend this for the mothers, that they can get these vaccines through our barangay health centers. Now, we have different vaccines preventable diseases, and these are the tuberculosis, poliomyelitis, diphtheria, tetanus, and of course the pertussis and measles. So these are the diseases wherein we can prevent this kind of diseases if we will just send these babies, or along with their mothers, of course, to avail the different vaccines in our barangay health centers. Now, the overall goal of the EPI is, of course, to reduce morbidity and mortality among children against most common vaccine preventable diseases. So then, for us to be specific about this goal, it is, of course, to immunize all infants or children against most common vaccine preventable diseases. And another thing would be to sustain polio-free status of the Philippines. Then, to eliminate measles infection, to eliminate maternal and neonatal tetanus, and to control, of course, the diphtheria, pertussis, Hep B, and German measles. And the last thing would be to prevent, of course, the extrapulmonary tuberculosis among children. Then this one is mandated by the Republic Act number 10152, Mandatory Infants and Children Health Immunization Act of 2011. So this meaning, this one is a very much serious activity for us, because this one is mandated by the government. Then, as you can see from the from this tabulation, so we have the different vaccines wherein these are the vaccines that we will be giving to the newborn. So as you can see, we have the BCG, which is indicated for tuberculosis. So this one is being given intradermal, and this should be given at birth. So same thing with Hep B, which is being given intramuscular. So of course, this one will be indicated for the hepatitis B, for the prevention of Hep B, and also being given on the first dose will be given at birth, and the second dose will be given on his 6 weeks of life, and the third dose will be given on the 10 weeks of life. And what about the other vaccines, which is the diphtheria, pertussis, tetanus, or the DPT, which is being given intramuscular. Same with HIV, or the HIB, the Haemophilus influenza type B vaccine. This one is being given intramuscular, and this one is indicated for pneumonia and meningitis. Same with rotavirus, which is being given per orum. This one is indicated for diarrhea. And the PCV, the pneumococcal conjugate vaccine, which is being given intramuscular and is being indicated for pneumonia and meningitis. And of course, the oral polio vaccine, that one is being given orally. Those vaccines were given on the first dose will be given on the 6 weeks of life. Then the second dose will be given on the 10 weeks of life. And the third dose will be given on his 14 weeks of life. So DPT, the HIV, the PCV, and oral polio vaccine have the same schedule. First dose 6 weeks, second dose 10 weeks, and the third dose will be on his 14 weeks of life. Now, what about the IPV? The IPV is the inactivated polio vaccine. which is being given intramuscular. So that one will be given on his 14 weeks of life. Now, what about the influenza? Influenza, the first dose will be given on his 6 months. This one is being given intramuscular, and the second dose will be given on his 9 months, and the third dose will be on his first year of age, first year of life. Then measles, which is being given subcutaneously, as well as the Japanese encephalitis, is being given on his 9th month. And the MMR and the varicella, which is being given subcutaneously. And same thing with the Hepa A, which is being given intramuscular, will be given on his first years of life. And same thing with other vaccines. These vaccines have the reported side effects, which are the pain, redness, and swelling at the injection site. And sometimes there is also fever, which range, of course, or might as well spike up to 38. So this is common at the more common at the second and third dose of vaccine. And some also have this side effect of vomiting, and of course abnormal crying because of pain, and of course the irritability. And some, of course with this kind of pain, there is also loss of appetite. So this one is normal and will also subside in 24 to 48 hours. So if with serious side effects, you might as well suggest or educate the mother to immediately bring the baby to the nearest health facility for urgent care. Now, moving on with the second topic, which is the pain assessments. So we'll be dealing with this topic, this pain assessment. Of course, we'll be focusing on the newborn. So pain is whatever the person experiencing it says it is, and it is existing whenever the person says it does. So meaning, we need to believe both verbal and of course the non-verbal expressions of pain. So for the newborn, considering that they have no verbal outputs, so we need to observe for their non-verbal cues. So evaluation of pain should be considered with as much as importance as a vital sign. So we have different vital signs, of course, and that includes, of course, the TPRPP, wherein it stands for temperature, the pulse rate, respiration rate, and of course the blood pressure. So that all of those are considered vital signs, and the fifth one would be the pain. Okay, so frequency of pain assessment, this should be scored using an evidence-based scale at a minimum of every 4 hours. So there are some institutions that they have this kind of pain scale, and this one is a pain scales sheet. This one is attached on the patient chart. Okay, so before you will give, of course, the pain meds, you need to check first for the vital signs or the pain scale. So after checking the vital sign or the pain scale of the patient, you need to redo the rechecking, of course. You need to recheck the pain scale as well after giving the pain medication for you to know if that certain pain meds has an effect on the pain that the baby is experiencing. Then, there are 3 types of measures to assess the child's pain. Of course, we have the behavioral, wherein this one is the best or the appropriate for infants and children with limited language. And of course, we also have this physiologic, and of course, this self-report. And considering that we'll be focusing on the newborn, of course, they have this difficulty, or not at all, to have this kind of self-reporting. So who will be the one who will do this self-reporting or reporting of this kind of pain that they are experiencing? Of course, it's the mother of the baby. So when it comes to physiological changes, of course, we'll be dealing with, of course, with the abnormal findings with regards to the vital signs. And that includes, of course, the heart rate, the respiratory rate, and of course the blood pressure. And another thing would be the palmar sweating, the cortisone level. So that one will be checked through the labs. And of course, the transcutaneous oxygen, the vagal tone, and of course, the endorphin concentrations. And with regards to behavioral assessment, we need to check, of course, the distress behavior of the baby. And that includes, of course, the vocalizations. And with regards to vocalization, of course, that includes, of course, the crying of the baby. Okay? So, how frequent and what is the strength of how the baby cry. And another thing would be the facial expression and, of course, the body movements. So, infant's response to pain. So, young infant, so you will notice the rigid body or the thrashing of the baby. And of course, the loud crying, the facial expressions, of course, of the pain. And there would be no associations between the stimulus and of course the pain. Even though the nurse is or the doctor is handling the syringe, and of course there's a needle on it, the baby will not cry because he has no knowledge with regards of the thing that you're holding. Okay, except if you will poke that syringe or that needle on the part of the body of the baby, that's the time that he will react on that certain thing, and that's the time that he will feel pain. Now, with regards to pain scale, so we have different type of pain scale that we use to assess for the pain of the patient. But for the newborn, it is best or suitable to use the FLAC pain scale. And FLAC stands for the face, the legs, the activity, the crying, and consolability. Okay, so the observer rated pain scale performed by the health practitioner, and this pain scale is designed for newborns up to age 7. Why 7? Because there are some children who reach that age wherein there is no verbal output yet. So we need to use the pain scale for us to determine or to know the pain that they experiencing. And this pain scale provides management assessment scale between 0 and 10. So 0 representing no pain at all. So as you can see from the tabulation, this is the FLAC scale scoring, wherein we have the different categories. As what I've mentioned before, FLAC stands for the face, legs, and activity, and of course the cry and the consolability of the newborn. So for the first column, wherein we have the 0 score, so it means that there is no particular expression or smile on the face of the newborn. There is a normal position or relax or the usual tone on motion to limbs when it comes to legs, and lying quietly. Normal position, moves easily. There is a regular rhythmic respiration with regards to activity. And with regards to his cry, even if the patient is awake or asleep, there is no cry noted. And consolability, the baby looks content and relaxed. So meaning the column 0 means there is a normal status of the baby. But then, if you will look at it from the column 1 and 2, you will notice that there is an occasional grimace or frown, the withdrawn or disinterested. Sometimes the most noticeable is, of course, the sad or the appearance or worried face of the baby. So that would undergo to the column 1. And of course, the legs, there is an easy, restless, tense, and the occasional tremors. So as you can see, it's only occasional. Okay? Then with regards to activity, there is a squirming, shifting back and forth, tense or guarded movements, mildly agitated, and shallow or splinting respirations. And of course, there is an intermittent sighs. Okay, and with regards to his crying, there is moans or whimpers, occasional complaints, occasional verbal outbursts, and of course, there is grunting. Sorry for the typographical error. So the constant should be placed on the column, on the score 2. Okay, so there would be grunting on the column 1 with regards to cry. And with regards to consolability, of course, there is a reassurance that the baby will be consoled with occasional touching, hugging, or being talked to. Okay, then with regards to column 2, or the column 3, I mean, wherein there is a score of 2, with regards to the newborn's baby, we have the frequent to constant quivering, chin clenched jaw, distressed looking face, expression of fright or panic. So that would be under the score of 2 with regards to his face reaction. Now what about to the legs? There is kicking or legs drawn up, marked increase in spasticity, and there is a constant tremors or jerking. Then for his activity, there would be arc, rigid, or jerking, severe agitation, head banging, shivering, breath holding, gasping, and severe splinting. So that is under the score of 2. Now what about with regards to his crying? There is a steadily crying, screams or sobs, frequent complaints, repeated outbursts, or constant grunting is under the score of 2. And with regards to consolability, even though the mother is there and he will hug or he will touch his baby, still there is a difficulty. So there would be pushing the caregiver away, or the resistance from the baby is very much noticeable on this column. Okay, so the comfort measures that is being given by the mother is it seems like it's useless. Okay, because the baby is experiencing severe pain. Okay, so that's it. So how to use the FLAC? Of course, we need to review the FLAC or the different categories with the family caregiver, especially with the mother. We need to explain everything before doing the procedure. We need to ask for her consent. Then we need to observe. If the baby is awake, we need to observe the child for 1 to 3 minutes. And if the baby is asleep, we need to observe the child for 5 minutes. We need to observe the legs and body uncovered, gently position child if possible, and assess for tenseness and tone. And of course, we need to console, of course, the baby. Then score pain, ranking each category from 0 to 2, grading the behaviors based on severity, and you need to total the score out of 10. So the interpretation would be, the overall score is recorded as 0, meaning the baby is relaxed and in comfortable position. And 1 to 2 means there is a mild discomfort of the baby. And 4 to 6 is moderate pain. And 7 to 10 is there is a severe discomfort or pain that the baby is experiencing. Okay? So that's it for today. So hoping that you've gained something from our topics for today. So I'm hoping to see you all next week for another topic. So please be ready on our quiz at exactly 11 a.m. That one is already posted on your LLMs. Thank you very much.